Welcome back to Trinidad and Tobago. Now, earlier we mentioned, when I wrapped up the last interview, we're talking about anti-aging and aging gracefully. And I can't just keep this with women, because men are also upping their game. You do realize in 2019, men are giving women a run for their money in relation to not just spending money on themselves, but, you know, fashion, looking well, their skincare. And everyone wants to age gracefully. I know I do. And after women, when you turn 30 to 35, you're like, oh, things start looking a little different. So sometimes you have to make an extra effort. But also, there are breakthroughs in medical science, and there are breakthroughs and there are products available that allow you to enjoy and tell everybody, oh, it is all me. Well, Dr. Rachel Eckel is on the Morning Brew. She's no stranger to us hair, and she's here to tell us about the latest anti-aging technology available. And if you have questions, well, we have all of the numbers on the screen. Good morning, Dr. Eckel. How are you?
Good morning, Hema, and good morning, Trinidad.
Now, you know, we talk about anti-aging, and with so many commercials, and that's a term that are anti-aging, and do you want to get rid of these age signs? So when we talk about anti-aging skincare, what are we referring to?
So anti-aging means that we want to look our best at any age, okay? And what market analyses and consumer analyses show us is that anti-aging is actually the #1 concern globally from a cosmetic standpoint. We know that as much as 71% of patients in their 30s and 40s say that lines and wrinkles are their #1 concern. We also know that millennials, as early as the age of 26, we see millennials starting to use anti-aging creams. In fact, I think my first anti-aging cream was when I was 23. I started to see my crow's feet around my eyes, and I said, Mom, what do you suggest? And of course, she led me to use a topical, a cream.
Now, you know, it's interesting you bring that up, because I know when I turned 30, that's when I started seeing, okay, things are changing. But prevention is always better than cure. So as a medical doctor, you know, we have some of the amazing images of your clinic. How early should I start, or should people start being concerned about anti-aging techniques, or start using anti-aging creams?
I think the field of medicine has changed in that instead of just treating something when it happens, for example, instead of treating a patient when they have a stroke or they have heart disease, we now have moved into the realm of prevention. And it's the same with anti-aging. We don't wait till we're 60 and everything has collapsed and there's deep lines and wrinkles and you need to throw the kitchen sink at it. Instead, we want to start at a younger age to prevent having to need surgery and to prevent having to need more invasive techniques by using topicals and things that can really give us beautiful effects and no downtime.
Now, we are bombarded. I'm hearing all my directors, they're going wow to all the images on our screen. Every day we're bombarded with ads on the media, on social media, about these anti-aging creams. And so you go to the grocery, you can go anywhere and find anti-aging properties. How effective are these anti-aging creams that I can buy over the counter versus something recommended by a medical doctor like yourself?
So what we know is that in consumer studies, 92% of patients say that they are dissatisfied with the results of their anti-aging cream. So patients want results, they want benefit, and they're not getting that from over-the-counter creams because the ingredients are too low or they don't have the right technologies in it. Now, conversely, when patients go to the medical doctor's office and they say, I'd like something for anti-aging, usually they give them a cream like retinoic acid or retinol that causes redness, dryness, flakiness, exfoliation, and the patient may use it for a month or two and then they don't use it again and they go back to the store-bought product because they don't want that downtime. What we know though is that patients, they have poor compliance with it if it has a downtime, and therefore they don't use it, so they don't see results. So there is a huge market gap for something that works, but something that does not cause any downtime.
So we're talking about something that works, and anti-aging is a huge thing. Trust me, we all want to age gracefully. So what is the go-to that everyone is now raving about?
So my favorite product, and I cannot stock my shelves quick enough with it, is called Growth Factor Serum. And this is an incredible product that contains growth factors that help to improve collagen and elastin in the skin. Now the beauty behind this product, and I'm going to get to this in a second, is that there was a landmark clinical trial that was done that showed that using this product over a matter of weeks, you can reduce the age of the skin by 6.4 years. So using growth factor, the clinical trials showed you can look 6.4 years younger in using it.
I'm going to also say this is my favorite product. But I sometimes skip parts of my regime out of tiredness, but trust me, this is my favorite. Not just because it's anti-aging and I'm at that age, but because it feels good. You know, when you talk about using this, how quickly do you see results? When I start using it, a lot of people expect an overnight miracle, but realistically, when do I start seeing results?
So in the clinical trial, I always think that when you're thinking about skincare or, you know, choosing a product, you should be guided by efficacy, by science, and by results. So in this 12-week clinical trial, what we saw with growth factor serum was that at the end of 12 weeks, 97% of patients said they saw dramatic improvement in their lines, their wrinkles, so that 97% saw improvement in anti-aging at 12 weeks. But they also noticed it as soon as 2 weeks in. So 80% of patients saw improvement in texture, radiance, tone, elasticity. So consumers want immediate benefit. You put it on immediately in the first week or two, you see results, but you also want cumulative long-term benefit in the background.
Women, and we're looking at an interesting one with our lines, and I smile a lot, and I have these interesting things that develop sometimes, and women are always concerned about these deep lines and wrinkles around your mouth, and you say it, it's just life. Does a cream like this help with that?
So I think that the most important thing is when it comes to lines and wrinkles, there's many different causes. You can have lines that occur because of the skin aging. You can have lines occur, for example, underneath the eyes. These fine little lines that you see just below the eyes, that is classic skin aging, okay? So that's loss of collagen and elastin. And we start to see that from about the age of 25 when our skin loses something called the anchoring fibrils in it. But then we can have lines that occur like crow's feet, smile lines, because of overactive muscles that grow too large as we age, and then you see those lines. You can also have lines that occur because of volume loss that might require something like dermal filler replacement. So not all lines are equal, and I think it's important that when you are considering improvement in lines, you be seen by a doctor. My famous mentor, Dr. Obaji, who is the #1 dermatologist in the world for the last 40 years, and we were together on your show about a year ago, he always says, you know, that if you have a stomach problem, you're not going to go to your personal trainer to solve your acid reflux. You go to a doctor. Just like the skin is the largest organ, and it needs to be treated and cared for by a professional. If you have a skin issue, you're not going to go to the mall for somebody to diagnose your skin condition. So when it comes to lines and wrinkles, I think it's really important that you have a qualified, trained medical professional assess your skin, tell you what is the cause of your line and wrinkle, and then give you the appropriate treatment.
Everyone will always ask Dr. Eckel when you use any regime, and I know that's the one question most people ask me because they know I'm a patient. Are there any side effects? What are the possible side effects of using a growth factor and other anti-aging products?
So growth factor serum, the beauty behind it is that over the 12-week clinical trial that we did, there wasn't one single side effect. There wasn't any redness, irritation, downtime, so patient tolerance was very high, which is why you mentioned before that it's the one thing that you won't skip ever.
It feels amazing. Trust me, your skin feels like silk, and I'm telling you because I use it.
And the other thing, like you said, is that we want safety. Now we know, for example, Hema, growth factors are a very topical, excuse the pun, but it is a very topical field of interest at the moment. Now, growth factors are not all safe. Not all growth factors in creams are created the same. For example, human-derived growth factors have been shown to cause cancer in skin.
Right.
So you never want to choose a cream with human-derived growth factors. You want something like synthetic growth factors that we can control and that are safe and effective, which is what growth factor serum has in it.
What are some of the other tips? You know, we talk about obviously visiting a medical doctor, getting these products, but what are some of the other tips to look young?
So I think after putting on growth factor, the most important thing after this would be sunscreen, because all of the changes we see in skin, irrespective of your ethnicity, every change you see, 90% of skin aging comes from the sun only 10% is intrinsic or related to your genes. So if you see discoloration, lines, wrinkles, acne scarring, these sort of things in your skin, wearing sunscreen every day can really mitigate these changes and give you beautiful skin. And I think that it's important to find the sunscreen that's right for you.
Because there are a lot, and people will say to you when they think sunscreen, heavy, oily, thick. A lot of people don't like the use of the word sunscreen because they think it's just so much.
So this one, for example, called Daily Share, is our #1 sunscreen in our clinic, okay? And Daily Share, everyone says, I don't want my skin to look white. I don't want it to look greasy. I just want it to go on nice and clear. And you can see if you put it on the back of my hand, it just goes on beautiful and clear. There's no shine, there's no smell. And so this Daily Share is actually my #1 selling sunscreen in Trinidad. It looks great on darker skin tones.
And it can also be used under makeup as well, because I use it all the time.
But remember also that about 20% of the population have a sunscreen allergy. So they would say, for example, when I use sunscreens, the sunscreens cause stinging, burning, irritation. So a physical sunscreen is more important in that category. And this one, it's called Face Shield by Color Science, is our #1 selling sunscreen. I think this is this the one you use?
Yes.
#1 by Color Science, looks great on darker ethnicities. And then, of course, the brush on.
The easiest thing that you could never forget. If you ever forget anything in life, you never forget this.
The brush-on sunscreen that is literally loose mineral sunscreen that goes on and you just don't see it. So that's great for reapplication throughout the day. So again, I think when it comes to anti-aging, prevention is key. If you buy a new car, you're going to start taking care of the new car from the day you buy it. Not 6 years later, then you start washing your car and, you know, putting the Armor All on. You take care of it from the start. It's never too young to start taking care of your skin and protecting it.
We talk about the young starting, and, you know, because a lot of times when people, I didn't start thinking about my skin until 30, 32 there. Which is really sad, and that's too late. You know, is it ever too late? As in, okay, so you talk about, you know, always look at your sunscreen. Even in your mid-20s, you can start looking at these products. But let's say, is it ever a point where it's too late? Where like, okay, maybe we should do something a little beyond anti-aging creams for you?
So the longer that the anti-aging process has gone on for, is the deeper it goes into the skin. It's almost like aging starts like a little weed in the skin high up, and then as we age more, it grows roots and it becomes deeper and we see more profound changes on the skin. So when we're young, we can correct a lot of things with topicals and baby Botox and things like that. But as we age, you need more because the damage is much deeper in the skin. So you may need a chemical peel, you may need stronger creams, you may need dermal fillers and whatnot in that case. But the key is to just start. It doesn't matter what age you are, there's always something that can be done to make you look and feel your very best.
What is the one thing all of your clients take for granted? The one thing that they're always like, oh, I really didn't know that?
Sunscreen. Most patients that come in and sit with me, 9.9 out of 10 of them don't understand the fact that the sun damages darker ethnicities. So when I tell them about sunscreen, they say, well, why did I never learn this? I didn't understand that sun creates acne, sun creates discoloration, sun creates dryness, sensitivity, lines, and wrinkles. So they think that sun damage is only something that occurs in lighter skin tones. The second most common misconception that they think is that it's only when I'm outdoors that I'm exposed to sun. And then I have to educate them, well, that's not quite true. You and I live and work indoors, and most of our sun exposure is what's coming in through the windows, the glass, the skylight. So they are stunned when they hear that. And when you show them photos of truck drivers and people who are exposed to sun primarily on one side that's coming in through the window, they are really taken aback and sad and disappointed that nobody told them this before.
Taking care of yourself and self-awareness and this whole, not just living in the moment, but being more aware of self. And people are now embracing the concept of living a healthier, more holistic life. What do you say to all of your new clients in your closing comments, Trinidad and Tobago?
I think that it's never too early or never too late to start. And I think that you should be guided by science, by efficacy, and by results. When I come on your show, Hema, you know that I love to give your viewers a special. And earlier on this year in March, we ran a special specifically for your show whereby we were offering a deeply discounted price on our initial consultations. We did it just for a limited time, but as I was coming back on today, I'm going to reopen that up. So there's only a few spaces, but when you call, you get a deeply discounted price on your initial consultation with one of our doctors. But in addition to that, we're going to throw in a free growth factor serum, okay, for every patient that comes in and books from your show with an initial consultation for their skin with one of the doctors. So you save almost $2,000 today with that offer.
And Trinidad and Tobago, for all of you watching, I can tell you this is actually my favorite product. If you follow me on Instagram, you're going to know that every so often I'm like, okay, this has to be my one go-to. I am a little tardy with the rest of my regime sometimes, but it's one that definitely, and make an investment in yourself. It's not just about, it's not vanity, it's not any, it's really about your health. And when you think about health, you think about wellness, you think about yourself. Sometimes you just have to do things to make yourself feel a little better. Dr. Eckel, thank you so much for joining us this morning. And remember, if you call today, there are discounts, and it's an investment in yourself that you will not regret. Trust me. We take a short break. When we come back, we'll have more for you.